the goal as we come out of this is to recognize, and Josh's numbers will sort of display this, is that we can patch things together in the medium and short term. But the long-term map and the long-term aspirations have to be for global manufacturing capacity for vaccines. And the roadmap to that is, yes, people have been talking about the TRIPS waiver and the intellectual property rights waiver, but that's not enough. But because the actual production of vaccines requires a technical know-how transfer. So the mechanism of how you share that is starting to be set up by WHO and other organizations, but companies have to want to, aside from giving the waiver, have to want to share that expertise. There's the need to create that physical infrastructure in places where this capacity does not exist, to set up those factors, to set up the physical infrastructure, but also to train local expertise and to promote that local expertise. And then to work on the supply chain. For mRNA vaccines, for example, the mRNA caps or other aspects of the way the vaccine's put up get produced by single companies. And those pieces are also under IP rights limitations as well. And so working on just setting up those things, but not working on expanding on the raw materials, it would be an issue. The other things to think about are manufacturing and health regulatory capacity. WHO did a study that said 30% of national regulatory bodies actually have the capacity to manufacture and potentially distribute safe vaccines. So working on regulatory capacity in low and middle income countries is going to be important, as will the health surveillance capacity once vaccines are produced, to ensure that there is oversight similar to what we have here with the CDC's vaccine adverse effects or VAERS system.